Imagine facing a hidden threat, a disease lurking silently within your body, potentially changing your life forever. That's the reality of prostate cancer, a condition projected to affect a staggering 1 in 8 men residing in Malaga province. In 2024 alone, the region witnessed 1,222 new diagnoses, marking a nearly 3% increase from the previous year. This makes it the third most prevalent cancer in the area, following lung and breast cancer. But here's the good news: early detection can dramatically improve your chances of survival and a full recovery. According to the Spanish Society of Medical Oncology, SEOM, prostate cancer remains a significant concern. Dr. Fernando Gomez Sanchar, director of the Institute of Advanced Urological Surgery, ICUA, emphasizes the critical importance of regular checkups. Prostate cancer often presents no symptoms in its early stages. A simple analysis could literally save your life, he states. Prostate cancer is the most frequently diagnosed type of tumor among men in Spain and the fourth leading cause of cancer-related deaths. Predictions estimate over 32,000 new cases by the close of 2025. So, what can be done to proactively combat this silent threat? While Spain doesn't currently have a mass screening program for prostate cancer like it does for breast, colon, or cervical cancers, there's a strong emphasis on early diagnosis. Dr. Bernardo Herrera Imbroder, head of the urology service at Hospital Clínico, advises men to start undergoing urological checkups from the age of 50. And this is the part most people miss: if you have a family history of prostate cancer, it's recommended to begin screenings even earlier, around age 40. Research has demonstrated that early screening significantly improves survival rates for individuals with a family history of the disease. Dr. Herrera Imbroder further highlights that with early detection and localization, the survival rate for prostate cancer exceeds 90%. He stresses that prevention hinges primarily on early diagnosis. Advances in surgical techniques, such as robotic surgery, are also playing a crucial role. Robotic surgery minimizes post-operative complications, particularly concerning urinary continence and erectile dysfunction, thereby enhancing the patient's overall quality of life. At Clínico, approximately 120 out of the 400 robotic surgeries performed annually are related to prostate cancer. Radiation oncologist Antonio Lazo Prados points out that the increased diagnosis rates are, in part, attributable to longer lifespans. As people live longer, the risk of developing age-related conditions like prostate cancer naturally increases. He concurs with Dr. Herrera Imbroder that treatment effectiveness is constantly improving. Surgical procedures are becoming safer, and advancements in radiotherapy are minimizing side effects, leading to improved survival rates. In fact, prostate cancer is now considered one of the cancers with the best prognoses, with a cure rate of approximately 90%. Technological advancements are also significantly extending the lives of patients with metastatic prostate cancer. Where survival was once limited to 2 or 3 years, it's now extending to 7 or 8 years, and progress continues. Cutting-edge tools, including artificial intelligence, molecular biology, early detection methods, and genetic tumor studies, are being integrated into the diagnostic and treatment processes. But here's where it gets controversial. Some argue that focusing heavily on technological advancements might overshadow the importance of basic preventative measures and access to care for all individuals, regardless of socioeconomic status. What are your thoughts on this? It's important to understand that prostate cancer often progresses silently, with 9 out of 10 diagnoses occurring in men over the age of 65, and the average age of onset around 75. Because the disease often doesn't present symptoms until later stages, early detection is paramount for successful treatment. A common screening method involves a blood test to measure PSA, prostate-specific antigen, a protein produced mainly by prostate cells. This is typically accompanied by a urological examination and personalized follow-up. A digital rectal exam, DRE, where the doctor palpates the prostate through the rectum to check for abnormalities, may also be performed. If any suspicion arises, an ultrasound and biopsy are conducted to confirm the diagnosis. Dr. Jose Angel Gomez Pascual, head of the urology department at Hospital Quirónsalud Malaga, echoes the sentiment that early detection leads to a high cure rate for prostate cancer. He advocates for the adoption of advanced technologies like prostate biopsy by fusion, which combines magnetic resonance imaging, MRI, and transrectal ultrasound to precisely target and biopsy suspicious tissue areas. While early-stage prostate cancer may be asymptomatic, as the disease progresses, certain symptoms may emerge. These include difficulty initiating urination, a weak urine stream, dribbling after urination, frequent urination, especially at night, blood or pus in the urine, blood in the semen, pain during urination or ejaculation, persistent hip or lower back pain, pelvic pain, unintentional weight loss, and loss of appetite. If you experience any of these symptoms, it's crucial to consult a healthcare professional promptly. Ultimately, early detection and advancements in treatment are transforming the landscape of prostate cancer care. But is enough being done to raise awareness and ensure equitable access to screening and treatment for all men? What are your thoughts on the current prostate cancer screening guidelines, and do you believe they should be expanded or modified? Share your opinions and experiences in the comments below.